You're listening to the Veterinary Innovation Podcast.
You're listening to the Veterinary Innovation Podcast. My name is Sean Wilkie, and along with my awesome co-host, we interview the innovators in this space every week. Ivan, please go ahead and get us started.
Yeah, I'm Zach, and I'm excited to introduce today a colleague of mine, Susie Samuel, and who's actually Dr. Susie Samuel, but because she is from the UK, they don't call each other doctor there. So, which I think you do know in the college. I think that now it's starting, but everybody that I meet there used to not call each other doctor. I think that that's a North American thing. But Susie Samuel is a compassionate animal lover and the founder behind Vet Help Direct. With over a decade of experience as a practicing veterinarian, Susie recognized the need for a more accessible and user-friendly approach to veterinary services. Her passion and dedication to have led Vet Help Direct to tremendous success, boasting a remarkable 12 million post-launch with 290 veterinary clinics utilizing their software and over 50,000 conversations every month. The impact of Vet Help Direct has been astounding, attracting over 7 million pet parents a year and partnering with over 1,700 clinics. Susie's unwavering commitment to the betterment of the animal welfare extends beyond Vet Help Direct, as she is also a founder and non-executive director for Vets Digital, a veterinary specialist digital marketing agency. Welcome to the show, Susie. Thank you for finding the time.
Thank you so much. It's really fantastic to be here, and thanks, Sean, for inviting us.
So, Vet Help Direct, can you tell us exactly what it does and what's the customer journey and how do these millions of pet owners get onto the platform and what do they do on it?
So Vet Help Direct is an animal health website that helps pet parents to understand how to best look after their pets. We believe that by enabling people to access really easily advice from vets, whether that's that's just a general vet through Vet Help Direct or their own vet through digital practice, by reducing those barriers so that vets can really influence the way that pets are cared for, is the single biggest way that you can influence animal welfare. And digital allows you to do that. So Vet Help Direct, we get 7 million visitors a year. We have listings for every single vet in the UK and reviews and ratings for them.
So, just again to unpack it a little bit to those that do not have visual of what it is. So, I'm a pet parent. What am I searching for? What am I getting as a service? And how does it work as a business?
So a typical customer journey would be a pet parent a bit worried about their pet, but not thinking of reaching out to a vet just yet. So doing what we all do when we're slightly worried about something, and that's Googling it. And then coming up with one of our articles, finding our vet forum, engaging with our content, and then through that content, realizing that they need a vet. And then they would be on a sort of journey through our website, through to the listings area, where they're able to compare all of the local practices. And we've got really granular, detailed information on vet practices, more information than Google has. So we understand the specialties, we understand the different health club offerings, opening times, and we have ready access through to be able to message those vets and contact them really easily. So we're reducing all the barriers in essentially creating new clients for vet practices and introducing them to the vets that are listed in our directory. And in terms of the business model, all of the vets in the UK are listed. So we want to be as useful as possible to the pet parents and make sure that they can find vets that are close to them. But vets can work with us and subscribe to us, and then they're able to have far richer profiles, so they can put a lot more details about their health plans. We provide widgets for their websites that help with review generation and help to display the reviews on the website. And we've offered a few other plugins like our symptom checker and poisons guide to our subscribed vets as well. And off the back of the reviews, we run the Best UK Vet competition, which we're just about to have the award ceremony for in 2 weeks' time. It's very highly fought over in the UK, and it's based purely on customer reviews. So it's not like there's a judge sitting over the top of it and deciding who is the best vet practice. It's the clients themselves that are feeding into that through leaving reviews on Vet Help Direct.
Can I make some analogies to just kind of solidify it in my head to different platforms that I've seen? So it's almost like a combination, and forgive me if you don't like that comparison, but I'm trying to build it in my head. It's sort of like a veterinary information network, VIN, but for pet owners, they can access opinion from the veterinarians, which is integrated with Yelp or Google reviews. Is that
I think you've really hit the nail on the head. And our whole ethos is that people don't understand when they need a vet. They can think they can fix things through Googling, and great, they can educate themselves. We just want to make sure that there's really good resources there to educate them. And so we don't just talk, we try and see everything through the pet parent's eyes. So, for example, we'll often write articles that are focused on the symptoms that pet parents will see rather than the conditions or the way that vets would classify that in our heads. So it might be like, why is my dog's poo green or something, which is one of our very popular blog posts. Why is my cat being sick? And then we also have the vet forum where people can ask our vet questions. And through that, we help them to understand that actually, basically the importance of the vet in the life of their pet, and why they do need to reach out and contact a vet, and they're not going to solve it all through Googling. And it seems to be very successful at doing that.
Susie, it's really fascinating. I've been following your guys' journey for a couple of years now. I think I remember talking to you, I think the first time at the very start of the pandemic. So 2019, I think something like that. And really interesting. So you guys are focused on the UK market alone right now. Is that correct?
So we are in the UK and Australia at the moment. With our software and with our listing site.
Okay. And then another question for you. One of the things that I noticed is you guys are on the client side, you're allowing these people to have these interactions on basically whatever platform they're on, WhatsApp, Instagram. I think there's a bunch of different platforms. And does your software aggregate that data in one portal for the vet clinic to make it easy for them to manage all of these messages? Or do they need to have accounts on all of these platforms? What is it that the software does for the vet clinic to make it
I
easier?
think you've just described it brilliantly, Sean. It is exactly what it does. It aggregates messages from all those different platforms into one place, so that the veterinary team are answering messages from Instagram, Facebook messaging, WhatsApp, SMS, but they only have one place that they need to check, and it's all fully integrated with the practice management system. So it's really simple and easy for them, but also very easy, and there's no barriers for the clients. They don't have to do anything. They can just use their normal messaging platform.
so? In the US, we don't have customers using WhatsApp. It's not really a US thing. I do think that people would use the Facebook Messenger and probably Instagram Messenger. I don't know if we have platforms that do that aggregation that well. Maybe I'm missing something, but I keep thinking about the workflow inside of the clinics because that's not a familiar workflow that we're used to. So without a buy-in from the hospital side, it's difficult to implement something like this. So if I went to any North American clinic right now and I would say, I'm going to take Instagram, Facebook, your phone system, and everything else, and I'll route it to you. Not every clinic has that sort of answer the chat message role, if you will. So I think that that's an evolution that we're seeing, that there's someone that is dedicated. Because if I'll think of throwing yet another thing at the customer support representative or receptionist, and they're answering the client, answering the phone, booking appointments, discharging patients, and here's another chat on top of it. So when you deploy this, is this a new sort of role that is more and more identified in the UK? Is there someone who is dedicated to that and essentially just responsible for the chat communication, and they're triaging the incoming messages and then converting them into tasks, medications, refills, initial appointments? Like, how does that flow work inside of the hospital? Is that a newer thing?
It's a really, really good question. Essentially, what we're doing is digitizing client communications, and that's a profound change. And with profound change, there obviously comes challenges, as well as huge opportunity for, in particular, time saving and operational efficiency. And it's really interesting the way the different clinics have adopted it. So when we started out, we were pretty agnostic. We just gave the tools to the clinics, and we were like, look, here's this thing. Your clients can message you any way they like, and how are you going to use it? And we've seen really fast adoption by the clinics. And our usage is increasing not only as we onboard more clinics, but also per clinic. Because what's happening is they start out using it in one way and with one particular team, and then it gradually expands and spreads to different teams. So obviously the way that they're using it affects who is going to be handling that. And to your point, is this a new role? And for some clinics it is, and for some clinics it isn't. What we find when we analyze the conversations is that for each conversation that happens on digital practice, it's essentially replacing a telephone call. So you're not adding to the work, you're changing the work. And to some extent, we're finding that there are some members of the team that have a particular affinity and they feel much more comfortable typing and dealing digitally with customers. And then there are other members of the team that are maybe not so keen and maybe would prefer to have the face-to-face. So we're sometimes seeing in some clinics that like there's members of the team that are particularly particularly reception, particularly focused on digital messaging, and other team members that are focused on the telephone. But in other clinics, we're seeing usage across all receptionists in a sort of smaller way. And then we're seeing roles in other teams. So, for example, we have a lot of clinics that do all of their post-op checks using WhatsApp. And they're in the UK, it would obviously be Facebook Messenger or Instagram Message if they were in the US. And so that will be the consulting nurse that takes all of those messages coming through. We see a lot of finance teams using it. So in the bigger hospitals, the finance teams will be using it for healthy pet club payments, direct debits, overdue debt. And it tends to be a single member in that team that deals with that. And then you've got the pharmacy team, and this can really revolutionize product ordering and repeat prescriptions, saving vast amounts of time by using asynchronous communication rather than synchronous communication.
Yeah, it's so fascinating, this idea of asynchronous versus synchronous, on the phone, as opposed to answering 5 messages at the same time and making everybody feel like they're getting that person on the other side. And with all of the challenges that we have in veterinary medicine, this idea of working asynchronously with a support team behind you seems to be potentially one of the solves for a lot of the issues that are facing this industry. Why aren't you guys in the US?
Well, actually, we've had a lot of interest from the US, and it's certainly we would love to be there. We're quite a small team at the moment, and our focus is on all of the UK clinics that are joining us so fast, and in Australia as well. But we do have plans to expand. And I was in WVC. I think I met you guys, and yeah, so we had a lot of interest from over there. So yeah, really excited to see how that could potentially work in the future.
So the other question that arises from that, so we're deploying in one of our clinics, we're deploying the virtual CSR concept because it is so much easier to hire people to work remotely, and I think that reception or CSR is one of those roles that actually does not have to be for the majority of things in the hospital. Do you see the clinics in the UK anticipating that as a finding your solution? They're now understanding that hiring remote could be actually much easier, and then they're creating the frameworks around that.
Yeah, it's another really good point, and we are seeing that a lot, and not just with the CSR teams, but also the vets working from home as well. So being able to reply to clients, flexibly and in their own time. And then we're also seeing the consulting nurse role sometimes working from home. So it just introduces a lot more flexibility into the workplace and a lot more options for people to feel really comfortable with where they're working. And then even like within the practice, we're seeing a lot of the answering moving to like a different back room because they don't have to be dealing with clients so much as well face to face.
Yep. And so another question about the vets, which is very interesting. We are looking at an interesting concept, and I don't know if this is the engagement that you're seeing with the veterinarians. So with the veterinarians answering, you don't want to run into someone having an expectation that at any point I text and I get a vet and the vet gets on the text with me. So do you have a way to sort of say, okay, now you're going to be texting with the veterinarian, and then instead of being 24/7 available and client have that expectation, is there a framework that you suggest that those vets that are answering remotely that they limit it somehow?
Yeah, I mean that's interesting. The way the nice thing about digital practice is a big part of it is the organization of the messages as they come in. So they can be sort of assigned to different people or to different teams. So actually, it really mirrors the way things happen offline, in that the message comes in and then the reception team are the first in line, just as they are if it was a phone call. They're assigning it to the relevant person or the relevant team, who's then dealing with it. Every message as well gets an automatic response initially, just to sort of set expectations on response time. But I think it's a really good point as well, as you've got to decide for your business what's right. Is the vet going to be giving out free advice or not? Does that fit with your business model? And if it doesn't, it's all the same training that we've seen happen over the phone, just now needs to happen, for this new format, which is digital asynchronous messaging. So with staff need to be trained and helped and supported to make the most of it. And it's a little bit easier than the phone because you've got things like templates. So you can actually have a big influence as a manager over what your team is sending out routinely, as well as that obviously speeding things up a lot for them as they're writing messages.
Susie, every time we do one of these episodes, they go super quick, but there's one burning question I got to ask you, which is, if there's a clinic in the US that's listening to this, are you guys open to working with them at this time?
We'd love to. So we have a very small piece of work to do to make us live in the US, but we've built our platform deliberately to be very easy to extend. We've already made it work in Australia and Ireland and New Zealand, so it's very easy for us to make it work for the US. So we'd love to hear from you, our first partner to make that journey with, and please let us know.
Awesome. Well, that sounded like a rushed soft launch if I ever heard one. You've heard it here first. So we like to wrap up the same way every episode. A couple questions for you as we wrap up. First is a book, YouTube video, something that inspired you along your journey so far.
Yes, well, the thing that I've just listened to, which was actually a recommendation of my business partner, Ollie, was the Lex Friedman interview of Sam Altman, who's the CEO of OpenAI. And it was just fascinating to understand the large language model and how it works. And I think the thing that I really left with was Sam Altman seems like such a thoughtful and considered person, and I felt very much more optimistic about AI, thinking that he is leading it, and very hopeful for the future. And I'd really strongly recommend listening to that. It's absolutely fascinating.
Excellent. That's not the first time it was recommended, and I will listen to that. Thank you for that suggestion. The second question that we ask, is there a guest that you think would be good for this podcast to introduce to our listeners?
I think Alison Lambert from OnSwitch would be great. So she's been teaching vets and vet teams about customer experience for years and years. And now her advice is just so relevant again as we enter this space of digital asynchronous messaging. Whichever platform you're using, it's a new skill for your team, and making sure that they're answering in the right way, they're creating empathy, they're connecting with clients is going to be really important. I think she would be very interesting person.
Thank you so much for listening to the Veterinary Innovation Podcast. If you want to hear about our new episodes, please follow us on any social media channel. Also, you can check out our website at veterinarynnovationpodcast.com. See you next week.